14 diseases that can be cured or prevented by drinking water. Today, we will discuss 14 diseases that can be cured or prevented by drinking water. Keep in mind that when I say cured, it doesn't necessarily mean the disease will disappear completely. However, it means that, especially for chronic diseases, we can keep them under control and avoid complications. Let's see which 14 diseases can be treated significantly by drinking water. And by water, I mean pure water, without flavorings, sweeteners, or caffeine. Let's get started. 14 diseases that can be cured or prevented by drinking water. 1. Urinary tract infection. Starting with the obvious, which many of us already know, is the prevention of urinary tract infections. When we increase our water intake, or anything else we are consuming, and raise it to about 3 liters or so, we help urinate more frequently. Of course, this flushes out bacteria, cleans the urinary tract, and prevents infections. This effect is particularly important in vulnerable populations, in this case women, as they have a higher prevalence of urinary tract infections. Definitely drinking 3 liters or more of plain simple water can help us significantly prevent these infections, as well as avoid complications like upper urinary tract infections, such as those in the kidneys, which can lead to chyelonephritis, a much more dangerous condition. Therefore, number 1 is urinary tract infections. 2. Kidney stones. There's also some logic here. When we drink more water, it goes into our bloodstream, and obviously this liquid reduces the concentration of solutes like calcium, phosphorus, and other substances. This, of course, leads to the formation of fewer kidney stones, as fewer are deposited. Preventing kidney stones is essential. And by preventing kidney stones, we are also avoiding complications like urinary tract infections, kidney infections, specific injuries to the urinary tract, and more. 3. Uric acid and gout. Continuing with the idea that drinking water dilutes the solutes in our blood, one of the most important is, of course, uric acid. In some patients, uric acid starts to accumulate, especially when we drink beer, eat red meat, and consume other foods. This uric acid builds up, particularly in distal joints, those far from the heart and the center of the body, leading to gout attacks. Besides gout attacks, high uric acid can represent a cardiovascular risk, as it may prevent blood vessels from functioning properly and later on may even cause heart attacks. When we drink more water, we reduce the amount of uric acid again because we are diluting it in our bodies. This prevents gout attacks, sometimes without medication, and lowers cardiovascular risk. It's important to mention that, again, it must be a large amount of water, about 3 liters, and it has to be pure water. It cannot be water with anything else added, otherwise the effect will not be as noticeable. Also, some patients, of course, will still need medication in addition to water. However, in many cases, with adequate water intake and a proper diet. 4. Diabetes. Here, when it comes to diabetes, I'm cheating a little because it's 2 diseases in one. On one hand, water is one of the most important treatments for diabetes insipidus, a disease that disables a hormone called antidiuretic hormone, which causes excessive urination. These patients urinate 5, 10, or even 20 liters of water per day. What they do to compensate for this is essentially drink the same amount of water. In many cases, these patients go undiagnosed, especially when the condition isn't severe. Someone watching this video might urinate 5 liters a day and think that's completely normal and natural, when it's not, or even 10 liters or more. They stay healthy simply because all the water they urinate, they also drink back. With large amounts of water, patients with diabetes insipidus may not even realize they have the disease in many cases. This is a bit more complicated because patients with diabetes insipidus not only lose water, but also lose electrolytes that need to be replaced. Still, water consumption is one of the main treatments for diabetes insipidus specifically. On the other hand, when we talk about diabetes mellitus, the classic type with high glucose levels that cause neuropathy, heart attacks, etc., it has been shown that adequate or even increased water consumption can benefit patients. When you drink a lot of water, it dilutes the glucose in your blood. which, as we know, is the main risk factor that damages a diabetic patient's organs. Of course, this water consumption helps protect those same organs. Additionally, it has been proven that drinking water helps regulate weight, keeping you feeling fuller for a longer period. This means you feel less hungry or take longer to get hungry, helping you eat healthier foods. Not drinking many sugary beverages like juice, soda, and so on, and drinking water instead helps significantly in controlling glucose, beyond the effect we mentioned of diluting glucose in the blood. Therefore, water should be an essential and the only beverage for diabetic patients. If it isn't, or if for some reason there's another problem with glucose, increasing water intake to 3 liters per day can benefit diabetic patients. I would make only one exception for diabetic patients who have kidney failure, and this, of course, is common. We have many patients with already damaged kidneys. In fact, diabetes is the leading cause of kidney damage worldwide. These patients cannot drink water freely because with a dysfunctional kidney, they may retain water in their body. This small population of diabetic patients cannot drink as much water. Diabetic patients without kidney damage need to drink water, and they need to drink a lot. Obviously, the difference between a diabetic patient with kidney damage and one without will be determined by a doctor through the proper tests. 5. Orthostatic hypertension and dysautonomia. This is a little-known disease. It mainly affects people over 65 years old and is something that we all suffer from. But younger people experience it less frequently, which is when we stand up and feel very dizzy, possibly even falling. It can also happen that when I stand up, I experience tachycardia, where my heart beats very fast to compensate. What's happening? When I stand up, my heart has to work harder to get blood to my veins, especially if my arteries are stiff and don't open and close easily, which causes this dizziness, and we compensate with tachycardia. Many elderly patients suffer from orthostatic hypertension, which again reduces blood pressure when we change positions. That would be the definition of orthostatic hypertension. Especially elderly patients undergoing treatment for high blood pressure often suffer from orthostatic hypertension. Most of the time, this hypertension is mild, and patients don't feel much discomfort. However, we have some who frequently suffer from this dizziness and even faint. Literally, they fall to the floor and may even get hurt. For these patients who have already fallen, or for those whose risk of injury is very high because, for example, they live alone, don't have a caregiver, or aren't very independent, it's extremely important to increase water intake. When we have more water in our bodies, it will be easier for blood to reach the brain more quickly at all times, and thus we can prevent episodes of orthostatic hypertension. It's basically the same for us younger patients with dysautonomia. Dysautonomia is similar. The body doesn't quite know how to manage our blood vessels, so they open when they should close or close when they should open. Water consumption in these patients, us patients with dysautonomia, will also help prevent situations where we faint due to changing positions, emotional stress, dehydration, and also from trauma, pain, etc. For patients with orthostatic hypertension and dysautonomia, consuming large amounts of water is essential. Again, 3 liters or more per day. 6. Constipation. We know that all the food we eat passes through the digestive tract, where it absorbs all the water we consume with food. When it reaches the colon, the last part of the digestive tract, where it turns into stool, the food continues absorbing water until it is eliminated. When this stool stays too long in the colon, it absorbs too much water, hardens, and becomes more difficult to eliminate. These patients, of course, have difficulty going to the bathroom and having a bowel movement. One of the main strategies we have to prevent it from hardening too much is to ensure that the stool is full of water when it reaches the colon. The only way this can happen is, of course, by consuming water regularly. Drinking water constantly will make bowel movements easier, more regular, and of course help us avoid all the complications associated with constipation. We all know about diverticular and the role our colon plays. Drinking water ensures that our colon remains healthy and avoids all the other complications associated with constipation. Again, diverticular, hemorrhoids, and even some studies show a link to colon cancer. 7. Heat stroke. This is somewhat logical. When it's very hot, and we've seen this in previous videos, which I'll link above, we can suffer heat stroke. The body loses its ability to regulate temperature due to extreme heat, and we experience severe health problems. We can faint, have seizures, develop hypothermia, the heart can fail, etc. One of the most powerful ways to prevent heat stroke is precisely by staying very well hydrated, especially during hotter seasons and in warmer places. When performing intense physical activities or simply when the sun is very strong, we need to ensure that we're constantly drinking water and still sweating. If we're not sweating, we have a very serious problem. We're urinating frequently, which means the kidney is receiving blood and filling with water. And of course, we don't have any other important signs of dehydration. We're not pale, and our heart is beating normally. We need to monitor all these things, especially in vulnerable populations to heat stroke, mainly the elderly and children. At 5 years old, there is a higher risk of heat stroke, and also for those over 65 years old. These populations should be drinking water all the time if they are exposed to intense heat, and we must constantly monitor them to ensure that it's not so hot that they could suffer heat stroke and, of course, dehydration. 8. Bad breath and dry mouth. Obviously, the mouth is the main organ we have for eating, but also for speaking. So we produce sounds, gases, and other things through the mouth. Not only that, but because we eat through our mouth, bacteria also live there and feed on what we don't fully digest. This combination can give our mouth a specific odor. Saliva helps clean the mouth so that only good bacteria remain, keeping our teeth in good condition to continue chewing and allowing us to remain healthy individuals. When our mouth isn't well hydrated, known as dry mouth or xerostomia, this can cause bacteria to multiply, leading to bad breath. We can also develop mouth sores, our teeth may begin to break, and we can get cavities. When we consume large amounts of liquid, this, as I mentioned, flushes out bacteria, reducing their concentration, allowing only good bacteria to remain. And it also nourishes our teeth, mucous membranes, and all the structures in the mouth. Drinking water constantly helps anyone maintain a healthier mouth and fresher breath. However, as I mentioned, people with dry mouth, those with xerostomia, can have it due to taking antidepressants, an autoimmune disease, or any other pathology. These individuals are particularly at risk of all these complications, and for them, drinking water more frequently will yield better health outcomes, in addition to, of course, a healthier mouth, fresher breath, less mouth pain, and they won't lose their teeth. Definitely, dry mouth and bad breath are some of the diseases that can almost be completely prevented by consuming large amounts of water. 9. Dry skin. We know that our skin is a shield that protects us from the environment around us. The skin needs large amounts of water because it is the largest organ in our body and is constantly exposed to the sun, ultraviolet rays, wind, bacteria, and all the chemicals we come into contact with. To keep it hydrated and healthy, we need to drink large amounts of water. This is especially important when we are exposed to more irritants for the skin. During cold seasons, when we go to a very sunny place, or when we come into contact with many chemicals, we need to ensure that our water intake increases to keep this important organ completely healthy and to prevent the formation of sores, ulcers, spots, or any other skin-related pathology. 10. Migraines and headaches. Dehydration is a common but often overlooked cause of headaches and migraines. When the body doesn't get enough water, the blood vessels in the brain can constrict, triggering headaches. This process occurs because the brain is highly sensitive to changes in the body's fluid balance. When dehydrated, the body tries to conserve water, reducing the supply to less vital organs, including the brain. This can cause the brain's blood vessels to contract, leading to pain and discomfort. Drinking water regularly throughout the day helps keep the body hydrated and can prevent or relieve dehydration-related headaches. It's especially important to drink enough water during intense physical activities, in hot or dry climates, or when consuming diuretic drinks like alcohol and caffeine, which can contribute to dehydration. Some studies suggest that increasing water intake may reduce the frequency and intensity of migraines in some individuals. One study found that drinking an additional 1.5 liters of water per day resulted in fewer hours of headache pain and less pain intensity in participants with migraines. While more research is needed, staying hydrated is a simple and safe strategy that may help manage headaches and migraines, along with other treatments recommended by a healthcare professional. 11. Chronic fatigue. Dehydration can significantly contribute to feelings of tiredness, fatigue, and lethargy. When the body doesn't have enough water, it has to work harder to perform basic functions like regulating temperature, transporting nutrients, and removing toxins. This extra effort can lead to exhaustion and chronic fatigue. Water plays a crucial role in many bodily processes that affect energy levels. It helps transport oxygen and nutrients to cells, remove metabolic waste, and support proper organ function. When dehydrated, these processes can be impaired, resulting in fatigue and decreased physical and mental performance. Staying well hydrated throughout the day can help keep energy levels stable, improve cognitive function, and combat chronic fatigue. Drinking water right when you wake up can also help wake up the body, boost metabolism, and prepare the body for daily activities. Additionally, replacing caffeinated or sugary drinks with water can help avoid the energy spikes and crashes associated with those types of beverages. It's important to note that while dehydration can contribute to fatigue, chronic fatigue can also be a symptom of underlying medical conditions. If fatigue persists despite adequate hydration, it's advisable to seek medical guidance to identify and treat any underlying causes. 12. Gallstones. While the relationship between water intake and gallstones isn't as direct as it is with kidney stones, some studies suggest that low water intake may increase the risk of developing gallstones. The gallbladder stores and concentrates bile, a fluid produced by the liver that helps digest fats. Bile needs enough water to stay fluid and avoid becoming too concentrated. When the body is dehydrated, bile can become thicker and more prone to stone formation. These stones can block the bile ducts, causing pain, inflammation, and other symptoms. Drinking enough water throughout the day helps keep bile diluted and flowing freely, reducing the risk of gallstone formation. In addition to drinking enough water, maintaining a healthy diet low in fat and rich in fiber can also help prevent gallstones. Fiber helps lower cholesterol levels in bile, reducing the likelihood of stone formation. Regular exercise and maintaining a healthy weight are also important preventive measures. It's important to note that while adequate water consumption may help reduce the risk of gallstones, many other factors contribute to their formation, such as genetics, age, gender, and certain medical conditions. If you suspect you have gallstones or experience symptoms like severe abdominal pain, nausea, or jaundice, consult a doctor for proper diagnosis and treatment. 13. Respiratory infections. Staying hydrated can help prevent and relieve symptoms of respiratory infections like colds and flu. When the body is well hydrated, the mucous membranes lining the respiratory tract remain moist and healthy, acting as a barrier against viruses and bacteria. Dehydration can dry out these membranes, making them more vulnerable to infection. Drinking water also helps thin respiratory secretions, making it easier to expel mucus and relieving nasal congestion and throat discomfort. Additionally, proper hydration supports immune function, allowing the body to fight infections more effectively. During respiratory infections, it's important to increase fluid intake to replace fluids lost due to fever, sweating, and nasal discharge. In addition to water, other fluids like herbal teas, broths, and diluted juices can help maintain hydration and alleviate symptoms. Avoid caffeinated and alcoholic beverages as they can contribute to dehydration. 14. Muscle and joint pain. Dehydration can contribute to muscle and joint pain, especially after exercise or in hot conditions. When the body loses too much fluid through sweat, muscles may be more prone to cramps, stiffness, and fatigue. Additionally, dehydration can reduce joint lubrication, causing discomfort and limiting range of motion. Drinking water before, during, and after physical activity helps keep muscles hydrated and functioning properly. Water also helps eliminate lactic acid, a byproduct of muscle metabolism that can contribute to pain and stiffness. Furthermore, adequate hydration supports the production of synovial fluid, which lubricates joints and reduces friction between bones. To prevent dehydration-related muscle and joint pain, it's important to drink water regularly throughout the day and increase intake during exercise or in hot environments. Additionally, consuming foods rich in electrolytes like fruits and vegetables can help replenish minerals lost through sweat. If pain persists or becomes severe, it's recommended to seek medical advice to rule out possible injuries or underlying conditions. Conclusion. That's all the information I wanted to share with you today. I hope this is very helpful to you and keeps you motivated to drink more water. Again, around 3 liters of water per day, pure water. This water, of course, should be consumed throughout the day to keep us hydrated. In special cases, always ask your doctor, your nutritionist, or whoever you're consulting to guide you on the right amount of water for you because, of course, it's different for everyone. We definitely need to drink more water than we do now, but it's not the same for everyone. With that, we're done. As always, help us change the world. Share the information. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.